Are you taking Elvanse or Vyvanse for ADHD and wondering whether your allergy medicines are safe to use alongside it? That's a really important question, and the answer depends on which type of allergy treatment you're using. Before we dive in, just a quick note, this video is for general information only and is not a substitute for advice from your own clinician. Always speak to your GP, ADHD prescriber, or pharmacist before combining lisdexamfetamine with any allergy medicine, including anything you buy over the counter. Right, let's get into it. If you have ADHD and also deal with hay fever or allergic rhinitis, you're not alone. Managing both conditions at the same time does require a bit of extra care. Lisdexamfetamine, the active ingredient in Elvanse, is a CNS stimulant that affects your heart rate, blood pressure, and autonomic nervous system. That means certain allergy medicines can interact with it in ways that are worth knowing about. Let's start with the most important one, oral decongestants. Things like pseudoephedrine or phenylephrine, found in some cold and flu tablets and certain allergy products, are considered the highest risk combination. Both lisdexamfetamine and these decongestants have sympathomimetic effects, meaning they can both raise blood pressure and increase heart rate. Taking them together may amplify those effects, which is why this combination requires real caution. What about nasal decongestant sprays? These have lower systemic absorption than oral versions, but they can still add to stimulant effects. If you do use them, keep it to short-term use only and check with your pharmacist or prescriber first. Now for some reassuring news, non-sedating antihistamines like cetirizine, loratadine, or fexofenadine are generally considered safe to take alongside lisdexamfetamine. These are the kind you typically reach for with hay fever, and they're the preferred choice over older sedating antihistamines like chlorpheniramine. Sedating antihistamines aren't necessarily dangerous, but they're not the first recommendation when you're already on a stimulant. Intranasal corticosteroid sprays, like fluticasone or beclometasone, are also a good option. Because they're applied directly into the nose, they have very minimal absorption into the bloodstream, and there's no known interaction with lisdexamfetamine. For allergic rhinitis in particular, these sprays are often a preferred route. One more worth mentioning, montelukast, sometimes prescribed for allergies or asthma. There's no direct pharmacokinetic interaction with lisdexamfetamine, but both can independently affect mood and behavior. If you're taking both, keep an eye on any changes in how you're feeling emotionally and flag those with your doctor. So what should you actually do with all of this? The most important step is to tell your prescribing doctor or pharmacist about every medicine you're taking, including anything over the counter. Lisdexamfetamine is a Schedule II controlled drug in the UK, and your prescriber needs the full picture to keep your treatment safe. Don't assume that because something is available without a prescription, it's automatically fine to combine. Always check first. If after starting or changing any allergy medicine you notice your heart racing, a significant rise in blood pressure, unusual mood changes, or any new or worsening symptoms, contact your doctor. And if you experience a serious or unexpected reaction to any medicine, you can report it through the MHRA Yellow Card scheme at yellowcard.mhra.gov.uk. The link is in the description. So to recap, oral decongestants carry the most risk when combined with lisdexamfetamine. Nasal decongestant sprays should be used short-term with professional guidance. Non-sedating antihistamines and intranasal corticosteroid sprays are generally considered safer alternatives. And always disclose every medicine, prescribed or over the counter, to your healthcare professional before combining treatments. If you found this helpful, drop a comment below, especially if there's another medicine interaction you'd like us to cover. Give this video a like if it was useful, and subscribe to the Bolt Pharmacy channel for more evidence-based health information.